Hello, everyone. Welcome to our presentation about positive organizational and HR factors in the healthcare sector, the impact of hopeful career state and work engagement. And today we have Issa Balushi with us, who does have 15 years of work experience in the healthcare sector as a head of trainer and professional development specialist. We have Yu-Ling, who is a global career service provider and does have more than 10 years of talent development and talent assessment experience. And I'm Farhan Sadique. I do work for a retail organization in management for a few years. And our PI, Dr. Yoon, is an associate professor and in workforce education and development. He is continuously guiding us through the project and helping us with on the background all the time. And we are very much grateful for his contribution to the study. All three of us are PhD students in Penn State University. And we're in third year in our PhD program in workforce education and development. So welcome to our study. And with that, I want to invite Issa Balushi to continue the presentation.
Thank you very much, Farhan. When we thought initially about the study, we thought we have gone through some previous study, which explored different aspects or different title, the purpose of it. And I was trying based on my experience working in the healthcare field in Oman for training and professional development specialist for more than 15 years. We thought that, this study is best fitted to be applied in Oman due to the stressful environment, due to the premature stage of having the policies and guidelines that support the career development in the nursing field in specific and in the medical field in general. And as you know, there was kind of limited attention to the policies and research and planning, which are very needed in this stage to improve the services and the outcome of the organizations. And also the failure to identify and link the healthcare professional engagement, job satisfaction, and other indicators with some antecedent or mediator factors in order to lead to the positive outcomes of the organizations. And having the healthcare setting in Oman, which is 50 years or less maybe since it started and implemented the services. Again, we have kind of premature guidelines and protocol that govern the whole process of HRD services in Oman. While starting about the purpose of the study, we thought about investigating how some positive organizational HR factors deliver the impact of employee career development practices and bring about positive organizational outcomes in the hospital settings. And also to explore the effect of organization career supports and perceived career support, supervisor support on employees' hopeful career state and work engagement and other HR outcome variable. For example, the job satisfaction, the turnover retention, and task performance as well. Also to provide the HR practitioners and leaders in the healthcare setting in Oman about guidance, protocols, recommendation, and advices, how they can improve the results of HR variables in non-profit hospitals in Oman. After the in-depth review literature, we developed this model. And actually, it went through different stages. We modified in different stages according to the literatures, the context, and our objective for the studies. And finally, we agreed to have this model where we thought that having hopeful career state and work engagement as mediators between the organization career supports, perceived supervisor supports, and the organization outcomes such as job satisfaction, the task performance, and turnover retention. So by that, we have developed seven specific hypotheses. Again, going through the literatures, we found that, healthcare setting in Oman, Middle East, and similar contexts are very stressful environment, which requires a lot of research and policies and planning and those things in order to improve the outcomes. And the support from organization supports are very essential in developing the potentials to lead to better job engagement, career hopefulness, and other variables. And also we found from different literature at the beginning, how important is the hopeful career state as acting as mediator and antecedents for work engagement, job satisfaction, turnover retention, and of course, the task performance. We have targeted a tertiary hospital, which has 1,500 employees, and we have more than 850 nurses. So we target this hospital. The healthcare setting in Oman, there are 12 different tertiary hospitals. So our hospital that we targeted is one of them. So we we included using the random sampling technique, 300 nurses, and 92 responses from healthcare professionals who are like physiotherapists, X-ray technician, lab technician to be included in this study. The whole process of data collection, like I think we lost it for 2 months, almost 2 months to get the data collected from those people. Unfortunately, it was like the start of the COVID thing. So like we went through different stages to collect enough data from those people. And those are the measures which we use to base our current model and project. So we use the organizing career supports, the perceived supervisor support, the hopeful career state tools, and work engagement as well, job satisfaction, the task performance, and the task turnover intention. So those are the basis of the basis tools that we use to develop our own or big tool in order like to go for the study. I'll go to now to Yu-Ling to go and sort about the analysis methods and other aspects. Yu-Ling, you can go ahead, please.
Okay, thank you, Issa. So the analysis method that we use is structural equation modeling, which is usually we call SEN. And the software that we use for this analysis is RStudio with the Levant package. And before we do the structural equation modeling, we do the item parceling solution for some of our measures because those measures contain a large number of items. So we use the item parceling techniques to mitigate the errors or to improve the fit model fit. And also we fit the model, we use the fit indices to evaluate our model fit. So as you can see, this graph is the result of the SEM modeling, and also the fit indices was listed in the table. And most of the fit indices pass the cutoff value of the indices recommended by other research. Just TOI is a little bit slightly below the cutoff value, which is 0.95. So this is the result of the past analysis. So as you can see here, 3 causal paths were supported by our results. So those are from PSS to HCS, and from HCS to WE, and from WE to TP. So this is very interesting result that we found that these 3 passes actually can come together, become in a serial order of the effect, which we found that is serial mediation effect from PSS to HCS, and then from HCS to WE, then finally reach to TP. So after we found this finding, we take a closer look to this serial mediation effect. So we do further conduct the serial mediation analysis. So we see from PSS to HCS and WE and TP, this path was proved to be significant. But if we look at each mediator here, so we can find that HCS actually serves a very strong effect in this path. So as you can see here, almost over 30% of the indirect effect actually account for the total effect by HCS. So we found HCS is a very strong mediator here in our model. So Farhan will help us to introduce our research applications from the results.
Thank you, Yu-Ling. So we have seen so far how we went through the study and how we came up different constructs and how the relationship. Now I'm going to talk about how we can use that in the practical research. As we have discussed these findings in different conferences, and we found very excited listeners, and we came up with different ideas. And perceived supervisory support and a hopeful career states both play important roles in impacting HR outcome variables. And the findings make implication for both HR practice and future research by discussing the best practice of career development intervention, increasing employee work engagement, job satisfaction, and task performance, while decreasing turnover intention. And while this project was in a hospital setting, but it can also enhance employees' hopefulness in the workplace constructing a hopeful career state will help organizations develop strategies in support in employee career development. And the study as a whole will facilitate the research in HRD in exploring significant antecedents to work engagement, which is known to be a mediator in many HR outcome variables. And then we're going to talk about the practical applications. In practical application, we thought about the current situation, the pandemic going on, and different organizations are looking for different ways to keep the employees motivated, to keep the employees hopeful. And we thought that that's where our study can play a significant role in the hospital setting, as well as any workplace where there is high stress environment. So the supervisors play an important role to employees' sense of hope in terms of their career, which in turn enhance their level of work engagement and employee performance. So this significant role can be used while we train and develop the supervisors in any organization. HR practitioners should empower supervisors to help employees create career hope for enhancing work engagement and task performance. Hope-based organization intervention for employee career development should be designed and implemented, and relationship among focal constructs such as effect of PSS on work engagement can be utilized in human resource development. And the findings such as impact of hopeful career state of work engagement can be used to improve workplace, and finding will be useful to improve job environment in healthcare sector in Oman, as well as we want to continue this study in different settings and different countries. That way we'll have a comparison based on what we can provide implications on the whole overall healthcare industry, and situation like this pandemic where our study can help the supervisors as well as the whole organization to improve their hopefulness among the employees who are working in such a stressful environment. We have provided all the references. If you want to look in the specific reference, please go through those. We have really good articles in there, and we are very satisfied with what we have found so far backing our study. And thank you for joining us. You can contact with any of us if you have any questions and concerns. We would be happy to answer your questions. Thank you for your time.